Hello, everyone. Welcome to our webinar presented by Altura Communication Solutions and our long-term partner, Avaya. My name is Larry Carlson. I'm the Director of Marketing for Altura, and Altura is proud to be one of Avaya's largest business business partners. We've worked with Avaya in the healthcare space for a long time. We have some mutual customers that have been with us for over 15, 20 years in healthcare. Altura serves over 400 healthcare locations, and Avaya serves thousands of locations. And those are from smaller hospitals all the way to large health plans and large campuses, corporate healthcare entities with 30 to 40 locations plus. So our presentation today is driving healthcare transformation, and we're going to be talking about outcomes, analytics, and intelligence. And our guest presenter is Warren Mak, and Warren is the Senior Healthcare Director at Avaya, and we've had a pleasure of working for a while. And Warren, thanks for joining us today, and we appreciate your time.
Thank you, Larry and Altura, for having me. Like you mentioned, my name is Warren Mak, and I'm part of the healthcare practice within Avaya that's focused strictly on the healthcare payers and provider and life science on their digital transformation. So I'm happy to be here to go through some of our what we see in some of the outcomes as well as the intelligence. So before we go into the healthcare arena, I want to touch a little bit on the digital transformation as we see today. As you see on the picture in front of you, where that old lady, which is not my grandmother, but certainly could be, she's looking at an event in real time, enjoying in life, but you see people around her looking through their phones, digitizing that experience. And that's where not just healthcare, but that's where some of the trends we're seeing right now that's going in terms of mobility, where there's a Pew study that happened last year that says 97% of all Americans have a cell phone, and of those 87% of those are using their phones to go online, to do a mobile experience. That's where we are right now when it comes to some of the digital transformation in terms of mobility, and as well as the Internet of Things. If I were to do a survey on the folks on this call, I'm pretty sure that more than half of the participants will have either a Lexus device or a smartphone or smartwatch that can be connected to monitor not just their health, but also their schedules. And as we go through some of the trends in healthcare, we talk a little bit about cloud, right? A couple of years ago, cloud was this word that no one knows about, but now cloud is big, especially within the healthcare space. No longer are hospitals doing data centers. No longer are they managing 24/7. They're looking into what they can do in the cloud. How can cloud scale when it comes to some of their infrastructure as well as their analytics? And when we talk about artificial intelligence, I remember there was a new study where Google had this artificial intelligence where they were able to make an appointment for a hair appointment, and it was so intuitive as well as humanistic that it came to the point where they had to put in a disclaimer. And so far, right now with artificial intelligence, there is disclaimers to say that you're talking to a machine because it is so interactive. It is so human-like in that sense. So when we look at some of the trends in the digital transformation, we have to look at all those possibilities, right? Those data analytics, those predictive analytics, and really wraps around the whole idea of data. And as we gather information about data about our participants, our patients, we're really driving towards the personalization of medicine, because since we have so much information about the patient or about the member, we want to be able to drive not just outcomes, but the personalization of those experiences. So when we focus a little bit more about transformation on healthcare, we talk about not just the growing number of patients from 2016 or 2060. We know that people are living longer. We know that people are being more aware of their health scores um, through wearables, through the EMR, and of course, they're being more informed on their healthcare. Going through WebMD or going through searches on the internet on some of their health events. And we also know that when it comes to seeing a physician or seeing a nurses, there's a big shortage, and there's a big disparity in terms of how many patients is out there and versus how many caregivers. So physicians, caretakers are looking more into AI to look at and understand not just the patient coming in, but also all of their needs, because patients are not just patients coming into a hospital, but really consumers of the service. And in order to be able to provide the best care, we need to look at the patient as a whole and all the information that can be provided. That's where we're seeing in terms of some of the healthcare and some of the transformation that we have. So what is Avaya doing? Avaya is focused on two main areas within the healthcare space. The first one of them is probably the biggest and the most mature, which is the patient access. And what does that mean? Patient access is when the patient either interacts with the healthcare system or a healthcare system interacting with the patient. But what information do you have of that patient, and how can you personalize that experience through some of the connections that we have with the EMRs or through the CRM? And of course, within that interaction, what does that care team collaboration looks like? Care team collaboration is really a ability for Avaya to provide a platform where a physician can interact with a specialist, or a nurse can get access to the physician the right time in the right place. And I'll definitely dive in a little bit more on those areas. So let's talk a little bit about patient access and the services today. So, one of my experience in patient access is I call into my hospital that I've seen for about 10 years. And each time I call in, they don't, once I give my medical record number, they don't really know who I am unless they have a record of me somewhere. And each time I would expect, a facility that I've seen for 10 years would personalize my experience based on my health scores or based on my medical record. And a lot of times we don't see that, right? And a lot of times when I wanted to interact with my healthcare facility, I don't want to do it over the phone. I want to do it either through the web because it was just a simple request, or I wanted to reschedule my appointment. I'm put on hold for sometimes 10, 15 minutes. And if I can't hold on to it because I have a meeting or I have something else I need to do, I abandon those calls. And there's really not a lot of visibility right now in terms of healthcare to understand why people are abandoning calls. Are they able to interact with patients in a digital manner, either by voice or by chat or by web? And of course, how can I address those calls? That's simple, like I want to reschedule or I want to cancel, as well as be able to free up that appointment in real time. So that slot that I have for my physician could be taken up by somebody who's on a wait list. So we don't really see a lot of that right now. And what Avaya is doing is have a solution where a patient can interface through a device of choice, either, like I said, through the computer, through the smartphone, and they could come into a facility for many different reasons, right? Either they're responding to a campaign, they're making appointment inquiries, or they doing a triage because they don't feel well, and they could do it through different ways, either through the voice, through email, through chat. And on the back end for a healthcare facility, what does that look like, right? And what type of attributes can I provide to the agent based on the fact that I'm calling, or based on the fact that I have identified who I am? Are they able to be proactive? Are they able to reach out to me? And what are those analytics? What are those those abandon rates looks like, or how quickly is the agent able to pick me up, and the skill sets, are they able to satisfy my need, through a first call resolution. And of course, the workforce management. Does it make sense to have these amount of agents available during the quiet times as opposed to the peaks and valleys that we know of? And so we could service the patients as quickly and as effectively as possible. One of the things we talked about in terms of the solution is, of course, automation, right? Being a patient myself, I want to be able to not just be able to do a reschedule or a verify appointment, but I want to be able to know where my physician is, because one of the things that we see a lot is, when a patient gets confirmed to an appointment, they show up either at the hospital or where they think the appointment is at, but obviously the doctor's office is somewhere else, and that provides a very huge dissatisfier to a patient, as well as a missed appointment. So one of the things that we can do when you confirm an appointment is for us to send you like a Google pin drop, so you know exactly how to get there. As well as, and we see this in some healthcare facilities, where if you need a ride a lot of times we see a lot of no-shows because I don't have the transportation. But if you say, yes, I need a ride, we could connect you with Lyft, and they could provide you some services to pick you up, as well as drop you off after the appointment. And I mentioned a little bit about, when I call to my healthcare facility, I'm put on hold for 10, 15 minutes. But what if it is busy and I do have to wait? There's a callback assist. So one of the things about callback assist is that, I can't wait because I have another meeting that I need to get to, but they put me on a virtual hold, and they could call me back. The agent can call me back at a time that's appropriate for me. So I think that's definitely a big satisfier for me, because it's not only am I not losing my place, but the agent can call me back when I'm available during the time that's most convenient for me. And the other automation piece of that is, of course, the patient verification. So one of the good things about patient verification is that once you're able to identify who you are or who the patient is, that opens up to a larger conversation, because now that you're able to access to the medical records, you can have a much deeper personalized experience. And I'll talk a little bit more about that personal patient ID further down. And of course, chatbot, which is the ability for a patient to go through the different prompts without interacting with the agent, either saving them some time, as well as the agent, for them not to be able to have any interaction with them. So one of the things about contact center is that it's reactive, right? A patient calls in, they want to reschedule, or they're sick, and how to triage. But what about contact center that's reactive? That's proactive in terms of reaching out to a member or a patient. So a referral. So usually what happens is that when a patient leaves a ED or a doctor's office, they get a care plan, and sometimes a care plan will include a referral, say a cardiologist. How is that healthcare facility or able to reach out to the patient and say, hey, I see you have a cardiology referral, can we help you? Can we make referrals based on where you live? So this way it keeps it within the healthcare system, as well as keep it personalized to the patient. And within Avaya, we have that ability to not just be able to reach back out to the patient, but be able to understand and know that they got a referral because of our integrations with the EMR. One of the things we talk about in terms of when a patient has a post-procedure is, of course, pain scale, right? We know that healthcare facilities are not paid when a patient comes back within 24 hours. I mean, that is a government regulation, and that entire return stay is no longer paid. So a lot of times what we see from healthcare facilities are once they have the procedure, they reach out to the the patient and say, hey, how's your pain, or how's your wound? Can we are we able to take a picture so we could look at the wound care, make recommendations to address some of those concerns, or even have them come back to an urgent care center for them to take a look at. And I think that provides a huge benefit, not just from a facility standpoint, but the patient standpoint in terms of how you follow up. Appointment reminder, that's quite simple, right? I have an appointment in a month. I get a reminder from a healthcare facility to say, do you want to confirm, reschedule, or cancel the appointment? So the beauty of that is when I do cancel that appointment, that gets real time fed into the scheduling system. So it frees up my appointment for another patient, but also has the ability to reschedule. So if I say reschedule, it'll look up maybe 5 instances where I could reschedule the appointment. And it usually happens in real time, and it also could be self-service, no agent interaction, and that I think self-service is critical and important for the patient, especially if you want to be able to drive no-show, the limitation of no-show rates. Targeted campaigns. We have integrations with the CRM system to not just be able to target campaigns to education like breast cancer awareness, but one of the use cases here is when we had this huge snowstorm in New England, and one of the main clinics were closed. What the facility was able to do was to blast an email to the patients that were supposedly coming in that day to say our clinics were closed. We'll reach out to you to reschedule, but do not come in because the weather is bad and we're not open. So those are one of the things where I think it definitely provides a proactive approach to patient interaction, but also a huge satisfier to patients.
Warren, question for you.
Yes.
As you were presenting, one of the thoughts that came up that I had was when we talk about the digital channels and connecting to the contact center, what are some examples that you can think of where hospitals connect? Are we talking specifically about the social channels like Facebook, Twitter, maybe LinkedIn? Is that what we're talking about being routed to the call center? Can you answer or give us an idea what that refers to?
Yes. The social media that I was referring to is exactly what you said. It's the Facebook. Usually, it's more Facebook than Instagram, where there is a person, usually somebody monitoring the social media. If a patient has any questions or any concerns, that can be addressed. Those where the agent will look at it, and if it's an existing patient, they could do their outreach back or be able to post those questions back into the social media platform.
Great. Let me just mention to folks that are joining us for the webinar, if you have specific questions that you would like to ask Warren, if you would use the chat box and send those questions to us, what we're going to do at the end of the presentation, we're going to review the questions. So again, any questions from our audience, use the chat window to send the questions, and then as we conclude with the presentation, we're going to review those. Thanks, Warren.
Thank you, Larry. So with everything I said in terms of how we interact with patients or members, it is important to state that we have, integrations with the EMRs you see on your left-hand side, because they are the information, they are the source of truth when it comes to how you interact with the patients, with the scheduling. If you want to look up their diagnosis code because you want to do a campaign, or even a personalized experience, because we know that oncology patients interact with the healthcare facilities a lot different than somebody that's coming in from an ED. So we do have integrations with obviously Epic, some of the big names, knowing that we are able to extract some of that information using their standard API. So what are some of the business values that we bring to the table? I mean, certainly from a contact patient access, it's decrease in no-show rates, right? And also increase in patients' appointments and the CSATs, because we are able to reach out to them, or they are able to reach out to us, are they able to make it to the appointment, or if they need additional services like a car service, right? And in doing so, we are able to recoup some of that money. We see revenue growth of $10 million because we are able to service those patients and correctly, as well as collections and billing. So what are the collections and billing? So I talked a little bit about proactive when it comes to appointments and rescheduling, but we have healthcare facilities where they reach out to patients because they have some copay that they owe, or some small collections, usually less than $100, where they could pay either by phone or online, where we connect them to our payment service. And what healthcare facilities are seeing is that they have pretty good successes in terms of collecting those type of payments. Obviously, with larger payments, it's a more of a personalized touch, where agent actually calls them and discuss their bill. So definitely the business value is there.
Warren, I don't mean to interrupt. Someone actually submitted a question asking, and since we just had the slide, I didn't mean to interrupt you. They're asking if you could elaborate a little bit more with regard to the technologies for EHR integration. So I guess they want to know if you could talk a little bit more about how,
of course,
the technology that you were mentioning, Avaya has, integrates with EHRs.
Of course, yes, absolutely. So every EHR has the ability to connect to outside systems. I mean, the reason the EHR exists is really an aggregate of information, right? They're able to connect to the labs, the pharmacy, and they connect through either HL7 or through an API. And what Avaya has is a custom API that can talk with their web services or the API, and we extract relevant information. And one of the things that I want to make sure we are very careful, it's not a connection where we could pull every single information off from the EMR, and we don't want that, right? And then I'm sure our healthcare facilities don't want that. The source of truth is always with the EMR. We want to pull relevant information that's actionable to the agent, or be able to be relevant to have those conversations with the patient. So either it's the claims data, or date of birth, so you could do a verification, or diagnosis codes when you want to do some of the billing collections or campaigns. Hope that answers the question.
I think it does.
Okay. Let me just move back to care team coordination. So I mentioned a little bit about the care team coordination in the intro slide, where the ability for, because one of the things that we've seen when we have conversation with nurses is that they're usually looking for people or things, right? They walk about 5+ miles a day, trying to find who's on call, trying to find who's the attendant. When we talk with the switchboard operators, that's exactly when the code comes, they have to look through their list on what the protocol would be, as well as look at who's on call. And a lot of times it's either on a spreadsheet or it's faxed to them, so they have to go through that whole script and procedure, and it takes time. It takes time, not just on providing patient care, but also it's as good as what's printed on paper. So what Avaya is doing right now, like I said, the future state is the current state right now is either you page a physician, you call them on the phone, you do overhead, or you do some kind of bedside alerting. And what Avaya has as a solution is is the ability to provide on-call codes in a device of choice. Either it's the desk phones on the nurse's station, or the mobile device that the physician has, where they could get alerted on not just the code, but secure messaging, or be able to have video or voice conference with either another physician or with the care team. So one of the things I talked about was the on-call code, where if a hospital has a code blue, um, they would be alerted, not on the operator, but also it'll dip into the on-call schedule. Either it's on a computer or an EMR. Well, it'll look up to say who is the on-call physician, and it's smart enough for them to page that on-call physician, and get that acknowledgement to make sure that it's seamless and as well as automated, and it cuts through the paper schedules, and want to make sure there's different scenarios for that paging. Either it's code blue or code red. It's adaptable and customized based on the healthcare facility, and it has escalation. So it'll either page the physician or do an SMS, and it gets higher within the protocols on that chain. One of the things that Avaya has is it's the Equinox, the attendant for healthcare, where it's able to look at the on-call schedule, is able to also look at the physician. If I'm a physician and I'm on call, but it will look at my my preferences. Like if I want to get paged first, or I want to get my phone to ring first, it'll look at those protocols. It'll know what my preference would be, and it'll follow that protocol. And the operator is pretty seamless in terms of they don't know if the page is acknowledged, as well as be able to follow the script on what to do next. So that's one of the things that it takes a lot of efficiency off from the operator in terms of looking at the on-call schedule, but also gives them the ability to monitor the situation, and be able to provide more assistance if needed.
Warren, sees, quick question. Who sees the information, or who in the healthcare organization is the information relevant to that is presented with the Avaya Equinox attendant?
So the information, what you see in the screen right now is the switchboard operator. They would number one see that a code or has been initiated, or if a patient calls and say I want to talk to this patient, the ability for them to pull up that patient to see, okay, is the patient a VIP, or which room the patient is at, and be able to connect them to that patient. Or if the nurses calls and say, I want to speak with the attending on call, they're able to look at the schedule and connect either through a warm transfer or a cold transfer to the attendant that's on call, using his protocols, using his preferences.
So it could be anyone in the healthcare establishment or from the outside calling in.
That's correct.
That's correct. Beneficial. Gotcha.
Okay, it's beneficial. And one thing is important to note is that if the patient is a VIP patient and is listed in the EMR as a VIP patient, then the attendant will see that as a VIP, and therefore you'll follow the VIP protocols, where you're not going to be able to transfer it to a patient unless it's explicitly stated by the patient record.
So there could be some screening protocol or whatever they want to set up.
Exactly, and that will pop up to the agent, and to make sure that that's being followed.
Good. Well, we have 2 questions that were submitted. Do you want me to present those to you? Okay. One of our folks is saying that they use ASCOM mobile devices, or their care team members use ASCOM mobile devices, and they want to know how Avaya's technologies work with these types of handsets.
Okay. That's good. When I talked a little bit about the whole care team collaboration, I mentioned that the care team can use a device of choice, and I was pretty careful to say that, and it is true. Within the Avaya platform, they could use the iPhones, they could use Androids, but with the ASCOMs, it's a preference for healthcare facilities because of the ability for the hospital to really keep track of those devices, and they could give it to the nurse on shift. So we have we actually work with ASCOM now, and we signed an agreement to be an OEM. What that means is that now the Equinox attendant, which you see, will be part of the OEM package within ASCOM, and it will be integrated with the directory, LDAP, and all the bells and whistles within the ASCOM device.
If a hospital had deployed Zebra Technologies mobile devices, or say SpectraLinks wireless handsets, does the Avaya infrastructure and technologies integrate or work with those as well, or how does that work?
Right. If it is a Android-based device where they are able to load the Equinox application, then it will work. Yes.
Okay, I know Zebra Technologies and I believe SpectraLink are both Android devices as well, and use the Android platform. So would it work pretty much the same?
It worked pretty much the same. Obviously, the OEM has more capabilities when it comes to some of the integration, but it will work the same. I mean, obviously, there's some nuances that we have to look at when it comes to the workflow and what some of the needs are for that healthcare facility, especially when it's not an ASCOM device.
Okay, all right, good to know. You mentioned workflows, and true enough, here's a question about Avaya as well. The question is, does the use of Avaya technologies and the improved workflows you mentioned work with or help drive HCA, HPS, and HEDIS measurements?
Yes.
I hope I said that right.
Yeah. So there's two things, right? So HCAP is you mentioned. HCAP is a patient satisfaction survey that's done post procedure, where where the government has a standard of questions. I think it's like 32, and they would ask the patient, okay, what is your experience with the healthcare facility? Did the patient, did the doctor provide you with all the details that you need to get better? What is your pain scale during your stay? What is the communication process? And I think that with the Avaya solution, that would help because of the care team coordination, where you are able to get access to the attendant or a physician on call, in real time, and get treated for that patient. If the patient, just say, pain scale goes up to a 9, instead of waiting for the physician to respond to a call and come back and do revision of the medication, they could have that. The nurse could have that conversation with the physician right away. Through the different methods that's mentioned. So that definitely can help some of the efficiencies, like I said, with the nurses trying to look for people and things. For the HEDIS scores. Yep.
So this question was geared more toward would Avaya Technologies and the workflows really help the healthcare facility with their quality initiatives and what have you? Maybe that's what they're leaning toward wanting to know, right?
Yep. So so definitely with the HEDIS scores, it's a really HEDIS scores is another government measurement by which payers are measured against the effectiveness of against each other, right? And I mentioned a little bit about the referrals, and I mentioned a little bit about how patients are kind of guided through that process. When I get a referral, do I need a pre-approval? But right now, with with some of the technology that we have, we are able to look at some those records. We are able to look at what is the next step from a patient continuum standpoint. And providers are really scheduling to say, okay, you know, Warren has this diagnosis. What are some of the things that we could really pre-approve him for right now, as opposed to him going through those hoops, going through those claims, and that increases the ability for healthcare payers to really interact with the patient in a very different way. And the HEDIS scores will show that.
Oh, this is a huge question. Our facilities are in the process of upgrading to Epic. Mm-hmm. Is Epic their EHR integration or something?
Yep. So Epic is is one of our most mature solution when it comes to our integration with any of the EMRs. So Epic is something that we have done. So as you move into your Epic solution, obviously you got to go through the implementation and go live. We will work with you and your Epic folks on understanding what that API is. As you know, when you go through any EMR, there's nuances, right? And Epic is no different when it comes to the nuances of your facility and what type of information, what type of data sets you want to be able to express, not just to your agents, but you know, in your facility. So definitely we will go through some of those workflow with you.
Don't laugh, but the question was, can you help us with that? So I guess you answered the question. That was pretty funny. Yeah, right. So there's one last question. It said you talked about automation. There's a question mark. What type of efficiency gains do such technologies provide?
Yeah, I mean, the efficiency gains is freeing up the agent so they could do more personalized conversations. And when I say automation is really the self-service, right? It's really the ability for, as a patient, be able to do confirm my appointment, cancel or reschedule without you know, the ability for the agent to really to intervene. And I think that's the efficiency is now the agent can address other patients as well as the claims in terms of paying off some of the co-payment. So self-service is what we see patients are wanting to do, especially for those simple type of requests.
So when we're talking about automation in healthcare, maybe maybe our question here was geared towards what other maybe aspects of automation. I'm trying to think of how else we could answer that question. So when we're talking about automation, we're talking about a lot of self-service options and workflows, probably, right?
Yeah, and as well as the ability. One of my slides has the patient identification. So we have a facility where a patient calls in and they have a automated IVR. The IVR would say, "Hey, is this Warren Mak? Can you tell me your date of birth, medical record number?" And once I am able to authenticate who I am, that information is expressed to the agent it'll dip into the EMR record, expose it to the agent. So that automation piece cuts back on, you know, the agent having to say, "Hey, you know who you are," and if they were to transfer you to just say medical records, you know, I wouldn't be able to say all that information again. That would be an automated process right there.
Gotcha. All right. That is a lot of information. Wow. All right. So if anyone in our audience has any questions or any afterthoughts regarding this presentation, I'll tell you, Warren, we really want to thank you and what have you. If we could provide everyone with our contact information, we certainly thank you for your time, Warren, and thank everyone in our audience for your time and for your participation in terms of any of the questions. If there are any questions that we can further help you with, or if you'd like more insights regarding the Avaya solution for healthcare and how Altura and Avaya together are working with regard to digital transformation of healthcare, please remember Altura. Our website is alturacs.com, and our phone number is 800-654-0715, and we do feature a 24/7 knock. And again, Altura and Avaya have been working together for a long time, and we hope to help you and answer any questions you have. Warren, thanks for your time. Folks, have a great day. Thanks for joining us.